So my name is Mehitabel. I am 28 and I am patient and research manager at the European Heart Network. But I also happen to live with CVD myself and have the first-hand experience living with this condition. And I'm still very much in the journey. So that gave me really a first-hand perspective on what patient safety means. That started 10 years ago when I first went to the cardiologist, and I was told my symptoms were just probably due to anxiety, and the same cardiologist actually prescribed sedatives, which are usually prescribed for depression and anxiety disorders. Well, fast forward to now, or 1 year ago, I discovered that I didn't need that, and as a matter of fact, my symptoms were still very much there. So that took away precious time for my correct diagnosis, of course, but also added to my body medication that I didn't need. And for me, this really means that, I could have addressed my condition before. So early, timely diagnosis and clear diagnosis and therefore early treatment can really make the difference, especially when you're young. For us and everyone, honestly, as patients, something that is really important is to ask questions and really listen to what you feel, what your symptoms are, and look for second opinions whenever you feel like maybe this doesn't feel right. I know it's not easy, and for young people especially, you feel also it's not really your place to question a doctor. You have to trust your doctors. I'm not saying that you shouldn't. I'm just saying that asking questions and really understanding what's happening, really understanding how to take your medications is crucial, because that's really how you can communicate, how you can go back to your doctor and say, well, maybe this isn't working, and really prevent something more serious to happen. By that though, while it's important that we do our part as patients, it's also important that the system, the healthcare systems really make this dialogue possible and make us feel comfortable being part of this dialogue. Yeah, definitely for me, there should be a culture shift from doing things for patients to doing things with patients. And I think really this should be embedded in the training with healthcare professionals. So really I feel this should be the patient's participation in the decision and awareness should not be seen as an inconvenience, as an extra step, but this should really be the standard. Absolutely. EHN, we push for the voices of patients to be heard at decision-making level, and we really push for all the entire spectrum of care, from prevention to early diagnosis, treatment, and proper rehabilitation. And when it comes to patient safety, we really see a gap when it comes to this communication and partnership with patients. And we at EHN, we are trying to push that for this notion of patient safety, intended also as not only as risk when it comes to surgery, but also clear and effective communication with patients. We are pushing this to be a core principle of the entire cardiovascular health policy in Europe.